then again, I am going to map out the patient's lung fields, and I'm going to start 2 centimeters above her clavicle, which is the apices of the lungs, and then I'm going to go down and around toward her lateral here. So then I'm going to percuss first. Well, first I'm going to feel for any crepitus. Any pain when I do that?
No.
Okay. So no crepitus is noted. Then I'm going to go in and percuss. And then I'm listening for a resonant sound here. All right, so no abnormal sounds. The sounds were resonant. Over the lung field, it was a dull sound, which is normal. And then I'm going to auscultate your lung fields. And then again, well, before I do that, I do want to note that the patient's jugular vein, there is no distension over jugular veins. If there was, I would bring the patient up to a 45-degree angle to see if there was still vein distension, but she does not have that. All right, so every time I move my stethoscope, I want you to take a deep breath, okay?
Okay.
Good. The lung sounds were clear. There was no wheezing, rhonchi, or crackles. And then now I'm going to listen to the heart sounds, which is 8 to man. So I'm going to start using the manubrium to find the angle of Louis into the second intercostal right sternal border. So then here's where I'd start with the aortic valve. So then I'd also be using the bell of my stethoscope doing this. So I go second intercostal right sternal border. Then second intercostal left sternal border is the pulmonic. Third intercostal left sternal border. Okay, and then down to the fifth intercostal left sternal border is the tricuspid. And then fifth intercostal space over to the midclavicular, which is the mitral. And while I'm here, I'm also going to look for any palpations of the apical pulse, which there's no heaves or lifts. So the S1 and S2 sounds in each 8 to man were clear. S1 and S2 was regular. There was no murmurs or abnormal sounds. And then I'm going to now do your upper and lower extremities.
Okay.
I'm going to start by doing all of your pulses too. So radial pulse. Is a +2 equally bilateral. Brachial's a +1 equally bilateral. And then I'm going to do so I can't feel the popliteal, so I'm going to go down to the posterior tibial. Which is a +2 equally bilateral, so that means that the circulation is going down. And then the dorsal pedis is a +1 equally bilateral. And while I'm here, I'm going to check the refill. So cap refill is less than 3 seconds, so the patient has good circulation. Then I'm going to check for edema over a bony prominence. So the skin comes back almost immediately, which states that the patient doesn't have any edema. Then I'm going to go up, do the same, check for any edema. The skin comes back within 3 seconds, so there's no edema in the arms. I'm going to check your So cap refill comes back almost immediately, so circulation is good. And then just to note again that the skin is appropriate for the ethnicity. There's no scars or lesions. There is a tattoo on the foot. It doesn't look infected, doesn't look raised. The skin is warm. There is evenly distributed hair growth throughout the body. And then I'm going to then do some abdomen assessment. What is a normal diet for you? Like, can you tell me what you ate within the last 24 hours?
This morning I had some cereal. For dinner I ate spaghetti. For lunch I had a salad from Panera.
Okay. So, and I see that you do have an old belly button piercing. Did that heal good? There's no problems with that? No? Okay. And then, when you eat, do you get nausea, indigestion, constipation?
No.
No. When was your last period?
Last month.
And are they regular?
Yep.
Is there any chance that you could be pregnant?
No.
Have you ever been pregnant?
No.
Okay, and then when was your last bowel movement?
Yesterday.
Yesterday. Any abnormalities with it?
No.
Are you on a pretty good schedule with your bowel movements?
Yeah.
And then how about urinary? How many times would you say you go a day?
Like 6 maybe.
6. Is that normal for you?
Yeah.
Okay, and then have you noticed any blood or mucus in your stool or urine?
No.
And then any burning or peeing at night?
No.
Okay. All right, so then I'm gonna go in and I'm going to auscultate your bowel sounds first. And then I'm going to use the diaphragm and starting in the right lower quadrant. Are you hungry?
I know you heard that.
So the bowel sounds are active in all 4 quadrants. Some places they were louder than others, but the patient did say that she hadn't ate, so she was hungry and she hadn't had a bowel movement today, so that's probably why, so which is normal. Then I'm going to go in and listen to the vascular sounds of the abdomen, and I'll be using the bell for that. So then I'm going to mark it out by doing a W, which I should say that the umbilicus is midline. Go like this. So I'll be listening for the aorta artery here. Okay. And then the renal. And then I'm going to do sideways to listen to the iliac. And then the femoral. Okay, so no bruits were noted. I would check the femoral pulse too, but not in this scenario. And then, are you in any pain at all with your stomach?
No.
Okay, so then I'm going to go in and I'm going to percuss in the same pattern auscultated, starting with the right lower into the, going a pattern into the left lower. So the sounds of the abdomen should be tympanic. So the sounds were tympanic, and then again, the contour of the stomach, the umbilicus is midline, the stomach is flat, and then, so you're not in any pain at all, so I'm going to do a light palpation going in about 1 centimeter. So let me know if you feel any pain at all.
Okay.
So I felt no bulges or masses in the stomach. None of that hurt?
Nope.
All right, so then I'm going to go in and do a deep palpation, which is about 3 to 4 centimeters, maybe even 5 centimeters. Okay, so no bulges or masses were felt. And so then I'm going to have you sit up. I forgot to do your carotid pulse and artery, so I'm going to go ahead and do that. And I'll do this one at a time so it doesn't obstruct. So it's +2 on this side and +2 on the other. So it's equally bilateral, +2. And then I'm going to listen, auscultate the carotid arteries. I'm going to do under the jaw, midway, and then here. And then I'll be using the bell of my stethoscope. So then I want you to take a deep breath in, and then on your exhale, hold it, okay?
Okay.
Now. Okay. I didn't hear you take the deep breath. Okay, and then again. Okay. So no bruits were heard. No adventitious sounds. And then I am going to just double check everything. So the pulses, I did the carotid, the brachial, the radial, the femoral I would do in a different scenario. Popliteal I couldn't find, but the posterior and the dorsal pedis was +1 and +2, so circulation is getting down. And then I'm going to have you get up for me, and I'm going to have you walk back and forth for me. Okay, so patient's gait was steady. She wasn't guarding. She shows no signs of respiratory distress. Her muscles are equally bilateral, her arms are equally bilateral, and same with her legs, they're equally bilateral. I'm gonna have you do some range of motions with your neck, just because I can't assess that while you're walking. So I want you to do circle, and then retract out, and then put back in. Good. Any tenderness when you did that?
Nope.
Okay. And then I kind of want you to just, any pain?
Nope.
Soreness, and then your legs. Good. So I want you to sit back down for me. I want you to grasp my fingers. Okay, good. So the finger strength is good, and then I want you to go like this. Push up on my hands. Good. And then push down on my hands. Good. So hand and arm strength is good, and then lay back down for me. And then I want you to kind of push my hands like a gas valve. Good, and then pull back up. Good, and then raise one leg. Good, other leg. Good, and then while you're there, I'm going to test your Babinski reflex. So I'm looking for a reflex of the toes. Good, and then, oh, that's okay. So the Babinski reflex, her toes did move. So you can sit back up. So is there any questions you have for me? Any concerns?
Nope.
Okay, so that completes my head to toe video.